Hello and welcome to my channel. In this video, I'm going to share with you the vaccination guideline in pediatrics in Canada and US, the contraindications and side effects of the vaccines. This video contains all you need to ace your exams, whether it's Usmle or MCCQE1, or even if you're just curious about vaccines. I'm going to tell you how to keep the vaccines in your mind through cool mnemonics that I will share with you shortly. If you find this video useful, hit the like button and share the video with your friends and colleagues. And by the way, make sure to answer my questions in the comment section. Those who actively listen and learn might get bonus videos in future. I will try to post one video every week to help you excel in your exams and at the same time learn everything by heart and apply it in your daily practice. To support, make sure to hit the subscribe button. Vaccination is a primary prevention activity or measure. Why? Because we prevent the disease onset or prevent exposure to risk factor. In general, we protect health through primary prevention. Modifying existing risk factors or risky behaviors is what we do in primary prevention. Some examples are bike helmets, wearing seat belts, practicing good nutrition, smoking cessation, banning substances, healthy sleep patterns. So the key word for primary prevention is prevent the onset of the illness before the disease process begins. So the keyword is preventing the onset of the illness. Whatever we do, whatever measurement or activity we do to prevent the onset of illness or disease would be a primary prevention measure. Now, keeping the keywords in your mind, is post-exposure vaccination a primary prevention measure? Post-exposure vaccination, primary prevention measure? Write your answers down below in comment section, please. To understand vaccines better, we need to know how they are made. There are several basic strategies for making vaccines. Let's see some of the major strategies. The most ancient strategy in preventing illness happened in 15th century. People in different parts of the world have attempted to prevent illness by intentionally exposing healthy people to smallpox. Some believe it started 200 years before Common Era. Then science stepped in. Yeah. First, we will see how bacterial vaccines are being made. There are two major categories for bacterial vaccines, toxoids and conjugates. Toxoids are modified protein toxins. Because they have been chemically modified, they are non-toxic, but generate a strong immune response. Two famous examples are tetanus and diphtheria. What about conjugate vaccine? In conjugate vaccines, they use only portions of bacteria, such as bacterial polysaccharides. Polysaccharides are sugars on the surface of the bacteria. This portion leads to a weak immune response. Therefore, they add a protein to the sugar to generate stronger immune response. A great example is Haemophilus influenza B vaccine that is conjugated with either tetanus toxoid or diphtheria toxoid. Two basic strategies are used to make viral vaccines, using killed viruses or live viruses. We can inactivate or kill the virus completely using a chemical. By killing the virus, it cannot possibly reproduce itself or cause disease. The inactivated polio, hepatitis A, influenza shots, and rabies vaccines are made this way. There are two benefits to this approach. The vaccine cannot cause even a mild form of the disease that it prevents, and also the vaccine can be given to people with weakened immune system. Next basic strategy is to use live but attenuated virus to make vaccine. Viruses are weakened, so they reproduce very poorly once inside the body. However, the presence of virus in the body generates immune response. Mumps, measles, rubella or German measles, rotavirus, varicella or chickenpox, oral polio, and intranasal flu are some examples of this category. Now let's review some general rules of vaccination. First, the only major contraindication of vaccines is a prior severe allergic reaction. Second, vaccination in less than 2 weeks old generates minimum immune response. That's why in Canada vaccination starts at 2 months old, but in US they give hepatitis B vaccine to newborns. Let's see what is the third rule. Third rule is vaccination in children often needs multiple doses to achieve the desired immune response. The elder the children are, the stronger immune response will be. And fourth rule, vaccine production way may be the reason for allergic reaction to the vaccine. For example, hepatitis B vaccine is generated in the yeast cell. Therefore, anaphylactic reaction to Baker's yeast is a contraindication for hepatitis B vaccine. Okay, I think now we are ready to check the routine vaccination schedule and see how we vaccinate children. As I mentioned before, vaccination in Canada starts at 2 months old and in US starts at birth. In Canada, let's see how we can remember the vaccination schedule. When the baby is 2 months old and 4 months old, the mom takes the baby to Dr. Hip. Dr. Hip stands for D is DTaP, R is rotavirus, H stands for Haemophilus influenza B, I stands for inactivated poliovirus, and P stands for pneumocoque. So Dr. Hip is DTaP, rotavirus, Haemophilus influenza, inactivated P virus, poliovirus, and pneumocoque. Then when the baby is 6 months old, the baby is already grown up, so the baby bites. The baby bites, and so baby bites P, so it would be Dr. He, not Hip. P is deleted because the baby can bite. So it's Dr. He. D stands for DTaP, R stands for rotavirus, H stands for Haemophilus influenza, and I stands for IPV. There is no pneumocoque at 6 months old. What about 12 months old? At 12 months old, the child says Mency instead of Mercy. So MenC stands for meningococc C. MER is MMR and the C is pneumococcus C. So MenC instead of MERC, MEN stands for meningococcus C and MER is MMR and C is pneumococcus C or 13. In US, you can memorize it with MVA, USA, MVA, USA, MVA. M stands for MMR, V stands for varicella, and A stands for hepatitis. A, this is another difference that in US they immunize children for hepatitis A, but in Canada we don't immunize children, all of them, for hepatitis A, on the high risk ones. So, and in Canada, they immunize children at 15-month old for varicella, but in US, remember USA, MVA, V stands for varicella. So in Canada, we immunize children for varicella at 15-month old. Let's see what happens at 18-month old. At 18-month old, the 18 in Farsi can be hijdah, hijdah. So the baby can already speak a little bit. So you ask the baby to say hijdah, the baby says hiddah. So HID, it's HID, it's Haemophilus influenza B, IPV, and D, DTaP. Or you can say at 18-month old, the baby can already walk, so the baby can hide at 18. And what about 4 to 6 year old? In 4 to 6 year old, the baby is already confident, so the baby says, "Ta-da!" and always go to VIP, or the baby is a VIP. So we say, "Ta-da!" Baby Mire VIP. TADA stands for TDAP, and MIRE stands for MMR, and V stands for varicella, and IP stands for IPV. At grade 7, they become men. Oops, no, they become human and start hip hop. So men stands for meningococc, and human stands for human papillomavirus vaccine or HPV, and hep in hip hop stands for hepatitis B vaccine. So at grade 7, they become men. Men is meningococc. Then no, they become human is human papillomavirus and start hip hop. Hep stands for hepatitis B at grade 7. So you remember that we said at age 4 to 6, the kid says, "Ta-da!" and Mira VIP. Then if you add 10 years to 4 to 6, it is age 14 to 16. Now the kid is a teenager, and the teenager says, "Ta-da!" again, but no more VIP. So when we say "ta-da," it's just 4 to 6 year old or 14 to 16 year old. But in 4 to 6 year old, they are VIP. But in 14 to 16, no more VIP. Okay, now let's talk about vaccines and their side effects and their contraindications, because that's a high yield topic that you have to know by heart. Each vaccine, mostly the contraindications, and it's good to know some of their side effects. So let's dive in. Do you remember Dr. Hip in 2 month and 4 month old? Also, do you remember Dr. He in 6 month old? And I'm sure that you remember that R in doctor stands for rotavirus. So, rotavirus vaccine is a per-oral vaccine. So it might cause diarrhea and vomiting, and it also can cause cough, and like most of the vaccines, fever. So let's see what are the contraindications of rotavirus vaccine. Any abdominal disorder, such as intussusception, is a contraindication for this vaccine. Also, in Meckel diverticulum and immune compromised situation are other contraindications for rotavirus vaccine. Do you remember that rotavirus vaccine was a live vaccine? So we can give it to immune compromised people. So intussusception, Meckel diverticulum, and any other abdominal disorder, and immune compromised children. Now let's talk about MMR, mumps, measles, and rubella. This vaccine is a combination of three viruses, so we should be ready for transient thrombocytopenia, skin rash that might take 2 weeks, lymphadenopathy, arthralgia, arthritis, and parotiditis. The parotiditis is a rare side effect for MMR. But what are the contraindications of MMR? It's pregnancy, compromised immunity, and gelatin sensitivity. I put a funny mnemonics for you down below for this MMR vaccine that I hope you laugh and you enjoy it. So those who can read the alphabet that I put down, read it and enjoy it, and hope you remember this mnemonic. So the contraindications are pregnancy, compromised immunity, and gelatin sensitivity. However, MMR can be given to healthy HIV positive child, and it's not contraindicated in healthy HIV. Now let's talk about that 4 to 6 year old child that was super excited and says "tada" and meet a VIP. You remember that the child was excited and was super happy and was considered VIP, but something happens when you vaccinate them that they're not enjoying that anymore because they start after vaccination at 4 year old they start crying for a long time, and they are hypotone, unresponsive, and sometimes in rare situation they may even have seizure on the day of the vaccine. So all the happiness is gone because of the vaccine. And which vaccine do you think is the culprit here that causes prolonged crying, hypotonic, unresponsive state, or seizure? You're absolutely correct. It's about Tdap IPV. So, what are the contraindications of Tdap IPV? Anything that has N in it. It's neurologic instability, or prior hypotonia in other vaccination, and also another N, neomycin or streptomycin anaphylactic reaction. Remember, in all of this allergic reaction, the prior reaction should be anaphylactic. That causes a contraindication for the vaccine. So prior anaphylactic reaction to neomycin or streptomycin is a contraindication for Tdap IPV vaccine. And Tdap IPV is the vaccine that causes prolonged crying, hypotonic state, and also seizure on the day of receiving the vaccine. Time to check varicella vaccine. Do you remember at what age we start varicella vaccination in Canada? Absolutely correct, at age 15 months. What about US? Do you remember USA VMA? So V stands for varicella in VMA. So in US they start at 1 year old, and in Canada they start at 15-month old. We repeat the dose in the VIP situation. VIP was 4 to 6 year old. Varicella vaccine may cause skin rash. That skin rash again can last for 2 weeks. And what are the contraindications? Contraindications are gelatin sensitivity. It should be anaphylactic reaction, pregnancy, or plan to be pregnant within 3 months. So it says varicella. Cella means cellaye, varicella, and varicella, varicella, varicella. Or you can use pregnancy and gelatin as P and J, and say P and J has 3 dots, and varicella has 3 layers: P, J, pregnancy, gelatin sensitivity. Next, time for DTaP vaccine. Do you remember Dr. Hip and Dr. He and Hide? These are the vaccinations for DTaP. These in Dr. Hip, Dr. He, and Hide stands for DTaP. So, what are the contraindications of DTaP? DTaP is contraindicated in first trimester of pregnancy and in any encephalopathy in prior doses. So encephalopathy in prior doses and pregnancy in pregnancy, just the first trimester. And remember, in any pregnant woman, Tdap should be given in every pregnancy, irrespective of immunization history. Tdap should be given to any pregnant woman in every pregnancy, regardless of immunization history. Ideally, the vaccine is given between 27 to 32 weeks of gestational age. So whenever in the exam you are in rush and you are not sure what week was it, week 28 is a golden week, so most of the intervention in pregnancy is being done in at 28. So you can just write down 28 week of gestational age. But in case there is a risk for preterm labor, we can give the vaccine at 13 to 26 weeks of gestational age. So the ideal week is 27 to 32, but can be given at 13 to 26. So first 12 weeks, what we do in first 12 weeks, we don't give the vaccine to pregnant women. Next vaccine is flu vaccine. So flu vaccine can cause myalgia, malaise, and if it is given with pneumocoque vaccine or DTaP vaccine, may cause febrile seizure. If it is given with pneumocoque or DTaP, it can cause febrile seizure. What are the contraindications of flu vaccine? Age less than 6 months, compromised immunity, and egg allergy. In egg allergy, trivalent and quadrivalent vaccines can be given, but it should be in an environment where anaphylaxis can be managed. But the live attenuated vaccine are contraindicated in egg allergy. Now I have a question for you. Do we need to consider skin testing for flu vaccine? Because now you know that egg allergy is an issue. Do we need to consider skin testing for flu vaccine? Write your answers in the comment section, please. Questions are: question 1, keeping the keywords for primary prevention in your mind. Is post-exposure vaccination a primary prevention measure? You can just answer in the comment section with Q1, yes or no. And second question is, do we need to consider skin testing for flu vaccine? Again, you can write down in the comment section for question 2, just Q2, yes or no. And if you don't know or you're not sure about the answers, no worries, because I will answer these questions first in the next video. So no worries if you don't know or you're not sure about the answer.